And on behalf of Dublin City Libraries, I would like to extend a very warm welcome to this afternoon's webinar called Health Literacy is the Best Medicine. And today's event is being hosted as part of our Healthy Ireland at Your Library programme. I'm delighted to welcome our guest speaker, Helen Ryan, who is Policy Officer with NALA, which is the National Adult Literacy Agency. And we're absolutely delighted to have NALA as a partner in our Healthy Ireland programme. They do absolutely incredible kind of work and do so much to kind of promote literacy and to make it accessible for everyone that may have, say, literacy or numeracy difficulties, and making sure pushing to the forefront that everyone has access to education and learning so that they can take a full part in society. So absolutely delighted to have Helen as our guest speaker today. Just to say that we will have time for questions and answers at the end of the session. So if you do actually have a question in the course of the presentation, just simply, if we could ask you just to pop it into the Q&A facility on your screen as distinct from the chat, and it just makes it a little bit easier, and we'll do our very best to kind of go through the questions then at the end, whatever. So without further ado, I would now like to hand over to our guest speaker, Helen Ryan from NALA. Helen.
Thanks, Terry. Hello, everybody. Nice to see you all this afternoon. Well, I can't see you, but hopefully you can see me, and we're all tuned in, and look forward to talking to you over the next sort of 40 minutes or so about health literacy is the best medicine. And as Terry said, if you have any questions at all, please stick them in the Q&A. And I'm going to ask a couple of things as I go through, and there's also the little chat box if you'd like to stick a few bits in there, or just make a note for yourself around this. The questions that I'm going to ask. So welcome, as I say, I'm from NALA, the National Adult Literacy Agency, and we work around all the areas of literacy and numeracy and digital literacy. And today I'm going to specifically look at health literacy for people. So I've sort of split what I'm going to share with you today into sort of 3 blocks. So I'm going to give you a little bit of information. So looking at what is health literacy and numeracy and why is it important. I think it's good to just look at some of that, some statistics and some detail there. And then I'm moving it very much into what does it look like for us as public, as patients, as customers, when we attend a literacy friendly service. So what does that look like? And I suppose health services, when I speak about them today, I'm talking about, first of all, hopefully something, if you're going into the pharmacy, so that's something hopefully not too unwell, maybe a head cold or something else, how we work with sort of the pharmacy side, moving into them when I go to the GP surgery. And obviously then if there's other sort of local community services, be it your the centre, the physiotherapist, speech and language therapist, and then moving into a hospital appointment. So it's sort of, when I say health settings, it's all of those together, and what does that look like if it's literacy friendly. And then finally, just to give you, yourself and myself and all of us some tips and strategies really around what to do when we're going for these health appointments or to visit our health services, and what you can do to make it a bit easier for yourselves. Great. So the first thing just to maybe, to have a look at is around what is the sort of definition of literacy, numeracy and digital skills. So this is a visual that NALA has produced in the last year, sort of explaining this. And at the very center there, you'll see, because we all take it, I suppose, for those of us that have fluent, literacy, numeracy and digital. When I may say fluent, I mean for those of us that pick up a leaflet and read it without thinking, we're in the shop and, oh, I've only just brought €10 with me, and I can roughly add up what I've bought, that I have enough money. These are skills that we use every day, and again, with digital skills, lots of us now are using our smartphones to access information, WhatsApp people, look up stuff. So these are core skills that we all, going through the system would have gained, and we've had to change and maintain them as we go on. And listening and speaking is also a key element of literacy and numeracy. And in a minute, we'll be looking at some statistics around that. But if you think about all of us who do these every day, sometimes we forget about them because they're just automatic. And we do them in all these ways of life here. You see the 4 ways there. We do them within our family environment. We do them in the workplace. We do them with health and well-being. So example, reading a leaflet, or if we're checking on how much sugar we're eating in our diet, we might be reading the back of labels of food, looking up a recipe, different things around that. And then in the social and community life, whether we're active out and about, maybe in groups, going to events, using our library and so on. So we use these skills every minute of every day, really. And then on the broader level as well, you see there around public services and democracy and farming and community, it is the visual sort of tries to bring that together. And we sort of had to present this like this, because I think sometimes people lose track a little when they hear that people have literacy needs in Ireland. They go, oh, how is that? But we have to remember, and we today isn't a webinar to go into the detail of how and the causes and effects of literacy needs, but I will be sharing with you how many people don't do these things as fluently as maybe we can do it. But that literacy really includes all of these. And it's not just the technical skills, because it also has the other elements such as personal, self-confidence, self-esteem, emotional. So health literacy and emotional is really interesting and strong. You know, I can understand something fine here today, reading it, but if tomorrow I have an appointment with the doctor and I'm given some news, you know, how, if I'm upset, that affects how I absorb that information. So emotional is key, and economic dimensions can be an issue there as well. So just hopefully that visual just sort of explains it for people and what literacy, numeracy and digital skills mean. The health literacy and numeracy, which we're here today, and I say health literacy, but there is a health numeracy piece as well. I don't dive too much into it, but health literacy, as you can imagine, is to do with the reading and understanding, and the numeracy is to do with the numbers side in it. It really is two parts of one coin, the way we look at it. So it's half about the services that I will go into today. So when I go into my pharmacy this afternoon, or I go to a GP appointment later this evening, am I being communicated with clearly, and does that service take account of possible health literacy and numeracy needs that I may have? So definitely the services side. And then the second side is, Helen, when I walk in the door, can I understand that information correctly? And can I make an informed decision? So it's two, we sort of trying to get to meet at the middle, that I come with some level of skills and abilities to take useful, clear information to me and see what we can look at on that level. So what does it really mean, improving health literacy and numeracy? Really means moving from sort of I like these diagrams here, they're taken there from New South Wales, is sort of a bit of a muddle. Oh my God, I have to try and follow information. When do I have to go to my next appointment? When's that vaccination? Should I vaccinate? Do I need to go for a mammogram? When's my smear test? All of that information in a sort of befuddled way, trying to move people to a position where they can understand all the information, they're clear about what their options are, they make choices that they're happy with, and ultimately that they are healthier. And I suppose there is a lot of evidence out there on this around, you know, good health literacy has some really good benefits, where you are healthier, you're going for your screening appointments, you have less visits to the hospital, and in fact, a really stark one, you live longer. So there's a real, we would deal with government and the Department of Health a lot on this. There is a real sort of cost benefit to investing in health literacy and numeracy is better for the whole of society. So I have a little video now. Michael Duffy from Cavan, who is a great gentleman. He went back to learn to read at 57, and he speaks a lot at these events. And I spoke to Michael recently, and just a very short little snippet here where I asked him about his journey of returning to learning, and also how he feels about dealing with health services. So it's about 6 minutes. I'm going to play this for you now. Hello, Michael. Lovely to have you with us today.
Thank you. Hello, Helen. And it's an honour. It's a great privilege to be here and giving my story to you. I started back. I couldn't read until I was the age of 57, and when I started read books and things like that, it changed my life. It was a big step going back from been dodging and jumping about for 57 years before I took the jump and went back in. But look, I'm happy. I'm happy where I am now, and I've done level 3s, level 4s. I've got distinctions in level 4 QTI, and I'm happy as I am.
Great. And Michael, just interested to talk today around dealing with health services and how you would have found that, whether it's the pharmacist, the nurse or the doctor, how did you find that?
In some health services they weren't just consistently the same, but I found health services, there was a lot of bureaucracy, there was a lot of forms. Like, I mean, you get a form in, like, I mean, well, especially a social welfare form, and all kinds of things to be filled in on it. I found that difficult. So I found that quite difficult. Another day, I'm sure the doctor, the one said it used to write in it, well, I don't think anyone could read the prescription. That would take a height. I agree, a qualification to read their prescription, but it would say you hand it in, the pharmacist give you out the medication, something like that, and take one every 3 hours, and one before meals and one after meal, all like that. There was an awful lot of reading to be done on things like that, and I found that quite difficult until some of them was brilliant. Well, what they done was, in one case was, we said there was a blue tablet, there was a red tablet, there was a yellow tablet. You take the blue tablet with a glass of water at lunchtime, you take the red tablet, and like that. Things like that was a great help. But in the initial stages, like, I mean, I found it quite difficult actually. So that's really my score on it.
And that's a great example that you give there as well, Michael, around how a sort of a pharmacist there is supporting you. Are there any other tips you would have for health practitioners when they're dealing with people and you're not sure if they may have some literacy needs, or indeed if they to fill in a form? What would you suggest that the health practitioner can do to make that easier for the person?
I'd suggest that talk more to the person, be able to read the person's, like, I mean, body movements, whether they're confident, they're lifting up the form and they're looking at it. If they're looking at it too long, that's a bad sign, like, I mean, because they should be fit to read her. Because and some of the actually forms that the health service, the health practitioners give you, there's too much information on it, and you're reading, like, I mean, a mile of stuff like that where you don't need to. If you have a particular illness, like, I mean, or a particular case, like, I mean, it should be only focused on that particular illness rather than a mile of stuff like that you have to skim and scam down through before you can get actually what you're looking for.
Great. And what about questions, Michael? How do you think questions can be dealt with?
Questions with the patient-doctor relationship. I think if you go into a doctor's surgery and they're explaining something to you, let it be good. You're going to get, when you go to a doctor's surgery and the doctor's sitting down, you obviously have an illness of some kind. And if you get bad news, like, I mean, or not so good news, it can be a wee bit of a shock to the person. So what I'd say is for the practitioner to talk slowly and explain what exactly that you need to do as a patient to improve your situation, but also in the conversation, rather than wait for the patient, i.e. me, to ask the question, for the doctor practitioner to say, well, have you a question now about that particular item? And just talk slowly, explain, and not just rattle it on, like, I mean, repeat it, go back on it, like, I mean, go back on little bits, and also talk slowly and get the message across. And then when they're finished and all like that, before the patient leaves the surgery or leaves the consultant room, ask them, is there anything else you'd like to talk about? Whereas there might be something else there in the background. Let them, is there something else you'd like to talk about? Things like that. That's really
great. And I suppose plain English is important as well, Michael, would you think?
Well, as I said, yes, plain English is very important, not to be coming out with these medical terms of big long words. The same message can be got across to a person in layman's language, if I want to put it that way, rather in the professional language. It's okay talking to professionals, like, I mean, in their language, because they understand, but an ordinary person coming in, and plus a person that has got not so good news from the doctor, they're dumbfounded, they're stunned, they're not fit to process the information they're getting. So it has to be delicately done in plain English to them. Like, I mean, short words, pauses, just a little bit of information. Let the patient digest that bit of information. Then another bit of information. Let them digest it. And in between each piece, it says the patient, like, I mean, is there anything you'd like to ask me about that particular piece? Wait for a few moments. Don't just keep moving on. Just wait for a few moments, because that person that got that news is digesting it. They're in shock and they're in upset or whatever. So that's my take on it.
Great. Well, Michael, that was really great to get that information, and thank you so much for your time today.
No problem, no problem.
And the best of luck. Have a good day.
And you too.
Great. So hopefully that was a short snippet for Michael, sort of explaining a couple of points there, and we'll be teasing some of them out now as we go through. And again, if anyone has any questions, please feel free to put them in, and we'll get to them either throughout it or at the end. So just over to yourselves, maybe in the chat box, if somebody wanted to just throw in a figure here, just to how many people or what percentage of adults do you think struggle with, say, reading a health leaflet? So what I spoke about earlier, trying to just take a health leaflet and read that. Do anyone want to take a guess at what percentage of adults you think might struggle? So Liz there says 30%. Okay, great. So anyone 40% there? Okay, Michelle and Laura's 40%. Great. And anybody 50? God, Susan, you're going right up there, but yeah, okay, 50. And anyone want to have a guess at maybe medication? So numeracy, if you want to put in a numeracy statistic, just put an N beside it maybe. So having a guess here at how many adults, as I say, struggling with you've given me a couple of stats there for the literacy side. Numeracy, anyone? 90%. Okay, God, so we're up. So we do have a survey to draw from, so it's just important, and 65% there. So people are feeling that there are many people out there who are struggling or who could struggle with some of this information. So the actual statistics and the figures are 1 in 6 adults find everyday text hard to read and understand. So I was using the example there a minute ago of a health leaflet. So you can imagine you're in the pharmacy today, you pick up a health leaflet on eating healthy, or you get a new medication and you open that. Shocking. Anyone take the patient information leaflet, tiny information on it. So we know that if someone has handed either of those, that 1 in 6 or 18%. So not as bad as maybe some of the stats there had thought, but it still is quite high, because it means that about 521,000 people in Ireland at an adult level struggle with basic text and basic information. And for numeracy, it is worse. So you were right, people who had higher numbers for numeracy were correct. And 25% of Irish adults would struggle with basic numeracy. And that could be something like working out. We'll look at this later on, a medicine label. But, you know, something as simple perhaps as instructions around when to take your tablets, or working out. Money is a big issue in terms of working that out. So it is, this survey was done, it is a while ago, but it's the most recent one that we have to look at, and it placed Ireland 17th place in literacy and 18th place in numeracy out of 24 countries. So it is, we're not in a great place, and we need to do more work on this. If there's anyone who's tuning in today who's thinking that they might like to go back themselves and brush up on their own reading, or on their own I suppose with numeracy or digital skills, which can be a lot of people sort of can find that a bit hard, they can contact their local education and training board. There's an adult literacy service all over, they're all over the country, there's 100 centres, and while they're not face to face at the minute, they are taking calls from people and trying to work with people in different ways. And we also have a free phone number. I'll share that with you at the end as well. But you can just look up Nala and we will talk to you over the phone about what you can do. So that there is certainly, for anybody that, or if you know anybody, there is help out there, and that you can go back and brush up on these skills. So again, people sometimes say to us, well, what do you mean by level 1? So I've just given you a statistic there, and I said, you know, 1 in 6 people struggle at basic information. What is basic information? What is level 1? So this is actually the back of an aspirin packet, and this was given to people in a previous survey in 97, but it's a good example, because the question that was asked on that aspirin packet was for how many days can you take, the maximum number of days you can take this aspirin or the medication. So again, for anyone that is sort of a fluent, I use that term, fluent reader, we wouldn't read this text word by word, because when you're comfortable with text and you're fluent with it, you'll actually just scan the text. So any of us that are looking, scan, oh, dosage, scan around there, grand, oh, not longer than 7 days. And we will pick that out, you know, pretty quickly. But for people whose reading isn't as fluent, they will tend to read every word. And if you're even reading that sentence there, and so dosage, and you're reading it in oral, 1 or 2 tablets every 6 hours, preferably accompanied. In fact, that's very time you're reading that, you've forgotten what's before it. So you can see it's, people can read, but it's actually the reading and understanding piece. So it's actually being able to say, I can answer that. And in that survey, actually, back in the late 90s, 1 in 4 people struggled, which was 25%. So we are getting better, but we need to do more on this. There was an EU health literacy survey, so somebody had written 40% there for literacy. So in the health literacy world, we do have a statistic, which is actually 40% limited health literacy, which combines the inadequate and the problematic. And again, that's around dealing specifically with health information. So I deal a lot with, do a lot of training with frontline healthcare workers. You know, we do a lot of training with nurses, pharmacists, doctors, and we would, you know, be really clear to say, look, the evidence is telling us. There's a survey, and there's actually a new survey coming out in the next few months. The results will be due by the summer. But the survey results will tell me that 4 out of 10 people who come into your surgery, your hospital, or your pharmacy today, 4 out of 10 will leave your health setting and not understand what they were meant to do. So that really is quite high. And it's really important that the services acknowledge that and then respond to that. And then equally for ourselves, which we'll be looking at in a minute, what are the tips that when we are going in and dealing with health services, that we can get the most out of a meeting with them. So just think about this for yourselves, just sort of a question. Again, if people want to throw it in, they can. But, you know, why do you think health literacy and numeracy is important? Does anyone have an idea why it's good that we have, you know, sort of strong health literacy and numeracy skills? Or just even think for yourself, you think, why? Because again, there is a lot. So a lot of what I'm talking about today is actually backed up in research and evidence. In particular, there's a lot of research on this area done in the United States and Canada, and some of our own universities as well. So the health literacy is important for a number of reasons, but in particular, and I sort of touched a little bit on it earlier on, but people who have limited literacy and numeracy skills tend to report poorer health overall. They're not attending their screening appointments. They are coming into the health services perhaps at a later stage when they're in a more serious position, more likely to be hospitalized, not as well understanding what their treatment is, and then maybe not adhering or not sticking to what the drugs they have to take or the new health regime they might have to do. So it really is important, because in general then they are reporting poorer health overall. We have a little bit of Irish research that has been done on this. So it is interesting to know that 1 in 5 Irish people are not fully confident that they understand the information they receive from their healthcare professional. So that's quite, you know, 1 in 5 people. And I mean, is it human or is it Irish when any of us go into a medical appointment and they might say something to us, and you have to take that inhaler now for 4 times a day for the next, you know, 4 weeks. And we, oh, grand, okay, great, thanks very much. And we go out, and maybe we just, with, you know, there's a lot of things that go on when we go into a sort of a health appointment, and how well do you know your doctor or your consultant, how comfortable are we asking. But I might have gotten that instruction, left the room, and never asked them why. So, you know, again, so that's a two-way piece there again when we talk about it being in the definition. The medical professional should have told me why, if I'm taking this new inhaler 4 times a day for, say, a month. But if they didn't tell me, then on me as the patient, I should have asked why. So while we're waiting for us all to get on the same page on different things, we need to be assertive and questioning, which isn't always easy. So I suppose just to acknowledge that, and that's the 43%. Look, 43% of us would only sometimes ask the healthcare professional, just even to clarify the information. You know, that's just simple clarification. Again, let's say they've thrown out, you're on a new tablet, and you must take this tablet now, morning and evening, and we'll see how you get on. You know, and again, to clarify, how do I get on? What does that mean? It's a bit vague. Does this mean I take this for 1 month, for 6 months? So it's really, I suppose, one of the most interesting health literacy advocates that I think we have in Ireland is Vicky Phelan. People are aware, I'm sure, have heard of Vicky's story. She's spoken many times about it on television and radio. But Vicky always asked questions, you know, and that is a really important part, and we'll be looking at that in a minute. 17% of people have taken the wrong dose of medication. You know, yes, if it's an extra paracetamol or maybe one extra antibiotic, hopefully won't be too detrimental. But if it's a really strong cancer drug, or if it's a particular drug that impacts on whether you can use machinery or drive, it is a big issue. So this is a really, you know, it's very worrying that if people are not taking their medication correctly. And then I don't know about how people find signs in hospitals, but and they are getting better. So this is old research enough, but 66% of people have difficulty understanding signs and directions. I actually did an audit in the hospital recently enough, about 2 years ago, before COVID, and I was given parts of the hospital to find my way around. And even with being able to read the signs and think, I got lost. So the hospitals, I think, are aware of this, and a lot of them are doing some really good work in trying to be better and have better navigation. More recent research then in 2015, again, probably interesting here that at least, you know, it's great to know Irish people themselves are saying, can we have less medical jargon? So we need to push that with the healthcare professionals, and, you know, they meet us halfway on that. I mean, embarrassment really is a huge issue for any of us. And one of the best examples of this was, we were talking to a HSE staff member a couple of years ago. She was at a launch of something, and she was in A&E in the hospital with her daughter, had hurt one of her bones in her arm. And the doctor said, oh, you have a spaghetti fracture. And she went, great, okay, thanks, great. And that's fine. But she said, I couldn't ask him what that was. And we, you know, and she was reflecting on this, and we said, oh, well, I couldn't ask him. Sure, I mean, I work, you know, in the HSE. Sure, we were saying to her, but you, just because you work somewhere to do with health doesn't mean you know everything. I mean, I would say I didn't go to medical school. I don't know every term. Medical language is not my speciality, nor do I need it to be unless I'm sick and I need to understand some of these terms. So it's a really interesting thing. We are embarrassed. We don't like really to ask questions. So that statistic was interesting, sort of reaffirmed, I suppose, what we do know. We don't really like to go back and tease things out as much as we should. And then the last one was interesting, around people aged 15 to 34 were least likely to ask a doctor, nurse or pharmacist to explain things. What we'd love to know, and definitely more research in this, I'm sure, is, well, who are they asking? So there was other research more recently that said, you know, they were asking their parents. They were obviously using the internet, which is not the best place to go for health information, unless you're going to one of the really reputable sites. And even if you go to hse.ie, or NHS is a good website too, and you go in with the symptoms, you know, the internet cannot and should not, absolutely no way, diagnose what's wrong. So again, we just, it's important that people do go to the right place and feel okay and not embarrassed to ask questions. So again, just maybe a little bit of reflective to think, people have been putting in some stuff there. I'll have a look now. But in your experience, when you engage with health services, what have you found? So again, if anyone, I mean, you can put in good, bad, delightful doctor, nice pharmacist, or otherwise. But I mean, I don't know, people just even reflect, have a think about that for yourselves as I move on to some more sort of experiential stuff now, see how you find it. So again, And hopefully you do have, and if you've had a bad experience, hopefully you've been able to sort of, and when I mean bad experience, for example, I was once given instructions actually around an inhaler, and from the doctor, it was a locum, and I didn't really understand why, but when I went to the pharmacy then, and I was checking, why, and she was explaining to me then. So sometimes your experience can be mopped up by other people, and we often hear a lot of the time that a lot of people actually ask the nurse practitioner in the surgery, what the doctor told me to do this, what does that mean? Because a lot of people feel that the doctor doesn't have the time to sit and maybe answer your questions, and they'll often use the nurse. So again, it is interesting just reflecting how people find. So people are telling us there as well, look, they are brilliant. Marcy is saying, you know, she asked the doctor and does explain, and the chemist is always helpful when I ask. Absolutely, the pharmacist really is a really important, I think, go-to place around questions. So this brings us into what does attending a literacy friendly, that just takes account of the fact that people who are coming in and out of the surgery, of the chemist, of the hospital may have literacy and numeracy needs, you know, and that we just need to consider that. So a great example of this, if you like, is really around signage. So that being, think about a hospital and signage. So if people are going to struggle a bit with some of the terminology, are we making it really clear? Great example, in talking to a hospital recently, a porter was telling me that he was spotted somebody walking around and around the hospital for quite a long period of time, and was asked, are you all right? I'm grand, I'm just looking grand. So didn't, and eventually went over and said, look, I'm sorry, but really and truly, where do you need to go that you're not finding here? And the gentleman said, well, I was told to go get an x-ray and to go to the x-ray department, and I just can't find it. And just thought he'd find it himself and kept walking. Well, he was actually looking for the radiology department, because there is no such place, you know, it wasn't called the x-ray department as such. Someone must have said it at that, it wasn't radiology. And very simple things that could be done in hospitals is, by all means, if it's called radiology, in brackets could be x-ray, and then you could actually have a little visual, a little symbol that showed a couple of ribs or something to indicate that that was the department. Same with the blood department. You know, if I was got to go get my bloods taken, could they have it written more simply with maybe a little drop of blood to tell me? And in fact, if anyone has been in, hopefully not too many people have been in hospitals at all recently, anyway, if you're all healthy and fine, but children's hospitals are particularly good at signage because they're trying to make it very friendly, and so they actually are a good model for that. But we really do, services do need to look and think, how do I communicate? What are my policies and procedures like? Are my staff aware? So one of the big things, good morning, how are you? Again, I was in Crumlin Hospital recently, and when I went in, there's no form to fill out. Now, this is even pre-COVID happening, but everything is, you speak to the person and they type in your information. So again, removing the embarrassment of maybe if my handwriting wasn't great and I didn't like filling in forms and I was a bit nervous, well, I don't have to do that now. I tell the person, here's my name, here's my child, here's the child's date of birth, and I don't have to actually fill that in. And that's a really good literacy friendly practice. And then finally, just in terms of evaluating and improving, that once people are aware of this, that they're always looking at how we can make our service better. And there's many benefits to this. Really, the main bits being that people understand what we have to do or where we have to go, and that we access everything that we're meant to access, and a better impact, and we're healthier out the other end. NALA has worked on these literacy friendly quality standards. Now, I'm not going to dwell on these, but just to say that we have these 10 standards that we've been working on for a number of years with hospitals, with some drug treatment centres. We've done work in primary care centres, and more recently we've a whole programme with pharmacies. So we have a thing called a crystal clear mark for pharmacies. And this is a mark that if anyone has a look, if their local pharmacy has it, it's a sticker that goes up in a certificate. If a pharmacy has complied with those 10 standards that I have there on the previous slide, and they fill in basically an audit online, I ring them, I have a chat with them, and then they get this award for 3 years. And really what it would say to you as a customer going into that pharmacy is that, that pharmacy has gone through the crystal clear process, and I know that they're speaking to me in plain English, that they could write me a plain English medication label if I needed it, that the staff are aware that not everyone is comfortable with filling in a form, or maybe automatically assuming that I'm going to be able to read that leaflet. So there's some just really nice pieces. One of the biggest friends of a pharmacist is a highlighter pen. So we always say to them, they always say, look, what does it say? This is my biggest friend, is my highlighter pen. Because if there is any worry that somebody isn't understanding what's been said, out should come the pen, and they're highlighting exactly what the medication instruction is on the label, or maybe the patient information leaflet highlighting information there. So it is a really interesting one and a good one to do. So again, just thinking for yourselves, thinking of when you've dealt with the doctor, the pharmacy, or a hospital recently, was there anything you can think that was really good that you liked? And is there anything that you think could be improved? So I'll tell you what I think really works well in hospitals when, again, I've gone, is that there is, and Tala is really good on this, is that there's somebody there chatting to you, and there's a lot of volunteers that work and unfortunately with COVID, a lot of this stuff is probably not working as it did, but there used to be people there that would help you. When you go into Tala, they have screens to check in, and there would be volunteers there who would help people. Can I help you today with making your appointment? Because you have to go and put in your information, and that's very nerve-wracking to use a screen, a touch screen, put in your information if you know, no one wants to go to a hospital anyway, you're a bit and in particular then if you struggle with some of the words or some of the directions on the computer screen, it's really nice to have a volunteer. So I think that's really nice. Somebody's there to help you and see can they do something for you. Then what could be improved? Well, that's an interesting one in terms of, and again, we worked with a group of adult learners with on Cosan, and they went to visit the hospital up there in Tala, and they felt that some things could be improved, and they wrote into the hospital and recommended things, and the hospital said, thank you, that's really good and interesting. We're in plain English, we'll have a look at that and we'll come back. So we're sometimes in Ireland, and I'm sure in the world, we can be sort of armchair critics, and we need to twist that on its head, and where we think something could be improved, tell them. So I know hospitals are really good at, I know it's online, some of this stuff, but patient feedback, if you've just been in it at a visit, or if you had to stay, tell them what they could have done better. It's probably a bit more difficult to tell your pharmacist what they might do better, but you can do it in a nice way. And again, at the surgery, maybe there's something that would have made it easier for people. So don't be afraid to make suggestions, because we will never have better services. First of all, we have to say what we'd like, and then obviously we need to be heard on the other side as well. So it is important. Great. So I'm moving on to tips and strategies, and again, coming to sort of the takeaway points for yourselves. And again, please, if you have any questions, put them in, and we will get to them now in about 10 minutes. So tips for visiting, and I'm just picking the doctor here. So the 4 things, and I've touched on sort of these as we've been going through, but specifically going to look at these 4 now. The first one is just being prepared for that meeting. So that's, we'll look at that now in the next slide. But, you know, I am prepared for the meeting with my health service or my health appointment. Second one is going to be I ask questions. So say that a few times. So if you take nothing away from the webinar today or from what I'm saying, is please ask questions. Don't be afraid. I do a lot of work with the help when I could meet people face to face. We did a lot of work with some of the Southside partnerships and went around and met a lot of older people's groups. And I love the fact that I think it's great. The older we get, the less embarrassed we are about asking questions. I think that's what the older people were telling me, things like, oh, a doctor said to them recently something that they didn't understand. And she said, stop a minute there now, doctor, please. And let me share with you that I did not swallow a dictionary for breakfast. So I have no idea what you've just said to me. And could you please say that to me again in language, or as Michael said in his bit, layman's language, please, so that I can understand it. And I think that's fine. And she did it with humor. You know, he laughed. He went, oh my God, I'm so sorry, of course. And he, you know, changed how he was telling her the information. And she left the appointment and the consultation, knowing what she was meant to know, rather than, and lots of us do it over the, oh yes, grand, thanks very much, no idea what they said to us, off we walked out and went, well, no idea what that was about. So really asking questions is really important. The third thing we're going to look at in a minute is just that checking that I understand what has been said to me. So that's another key little strategy and tool. And then the last thing is around, you know, make sure that before you leave a meeting that these 3 questions are answered for you. And we'll look at that as well. Okay, so being prepared for the visit. So just before you go to your appointment, hospital, doctor, even before you go down to the pharmacy to pick up your repeat prescription, or, you know, the headache that you have for everything, write down any questions you have beforehand, because it'll help you remember. So let's say I have a blinding headache now, and I'm going to go to the doctor, go down to the pharmacy and ask them, what'll I take for that? And think, oh God, what medication am I on at the minute? Oh Jesus, yeah, I'll just get a note of that now. I'll write that down. And when I go down into my local pharmacy and I ask them what should I take for my headache, I can also show them, here's what I'm on at the minute, and make sure that whatever they recommend for me doesn't clash. So write anything down. The second thing is to always take a little note book which I want to look up later, if there's an instruction that you're given, any little tips and information, just jot them down. And finally, and I mean, not everyone is comfortable with jotting them down as well, but so the third one is very, very important. And in particular, if you're going for results, and I know again with COVID, this is probably really challenging because I'm not sure people are allowed to have people with them at appointments, but really bringing a friend or a family member with you to help you remember what was said, or to help you, as I say, if you're going for results. And it's really hard to get results. And again, we've done a bit of work on this. People say, oh, I'll bring, like, try and bring, I mean, one woman was saying that, you know, she brought her husband with her, and the news was, you know, it wasn't fatal, but it was bad news. But then everyone was crying in the appointment and nobody could take anything. So try and bring maybe, again, someone with you who you think could hold it together and take and ask questions and be with you there and get some of that information. Now, a really good literacy friendly practice from a doctor giving results, first of all, is they give it to you, ask you, do you have any questions back? And then actually, if they can, say to you, I'm going to leave this for today now. Imagine there's no immediate decision. So I was working with some of the work on prostate cancer recently, and they were explaining to me that sometimes you have a little bit of a window that you don't have to make immediate decisions for surgery or for treatment. So you can sit with the information they've given you for a week or two and come back for, here's your next appointment, and I want you to bring back any questions at that appointment. That's really good, that if you have a time to just absorb and take in whatever information is given to you. So just being prepared as best you can for your visit. So the second one we're going to look at now is I ask questions. So that's this one here. So again, you know, being honest. Think about the lady and the I didn't swallow a dictionary, and please feel free to, I should have told her to copyright it, but feel free to use that one. Just tell them, I didn't understand what you said. Another great health literacy advocate, Michael Power, that we work with from Tipperary, he's great. He explained when he was talking about being in the hospital with his son, and his son had a I can't even pronounce it, but it was a big long term, and he was trying to say to the doctor, I don't know what that is, you know. And again, none of us will know what that is. We are not medical. You know, I am not a doctor. I didn't study it. But don't be afraid to say that. I mean, that's nothing to do with being able to read or intelligence or anything. I don't get that term because it's not in my vocabulary. It's not in my world. And ask the doctor to explain it to you. If you're given any information, hopefully it is written in plain English. We're working with health services on that. Not everything is at the minute maybe, but we're doing work with hospitals around letters, and we work plain English hugely with the HSE around leaflets. So hopefully you'll see a plain English mark, or it's written in plain English. And if not, maybe just ask, I'm not understanding this. It would be, there's a bit of feedback you could give someone. I didn't understand that leaflet. It would be great if it could be written in plain English. That's it. And leave it there, and hopefully it might be changed for the next time. And then another sort of key one again is if you think you do need to follow up on anything, make sure you have some contact information. Who to call when you go home. So a great one here, one of the gentlemen was telling me at one of our sessions, he had to get his wound, he had to go down to the surgery and he was a certain day, and we'll see you again next week, John. And that was great, thanks a million, fine. And then afterwards he was going, but hold on, what happens if between, today is Wednesday and I'm not seeing you again till next Wednesday? What happens if on Friday, and Friday's probably okay because you could ring the surgery and check, but Saturday or Sunday, my wound all of a sudden starts to throb or might have an infection? What do I do? Who do I ring? Do I touch it? Do I do whatever? So again, just checking in for knowing the information, ask the questions, and then have some contact information about where to go. And another good example as well around sort of all of this area would be things like abbreviations and acronyms. And again, if this is a funny one, but if the NAS paramedic arrives and takes you to the nearest ED, the doctors and nurses say you need an IV, MRI, ECG and CT, and all of this before being admitted to the ICU. Now, if anyone watches any of the Grey's Anatomy or any of the TV shows, Casualty or any of those, some of those, acronyms will be slightly familiar. We ED, oh, okay, that's the emergency department. An ECG, even I was like, what's that? It's something to do with you lie down, you get a scan. CT, is that to do with the head? All of this jargon stuff. And, do we understand it all? Well, first of all, even in the best of our health, I don't think we'd understand everything. And you add that issue of emotion, upset, sick, illness, I feel awful, you'd let them do anything. Oh, whatever, fine. And really, how comfortable are we with asking? Now, in some cases, if we're ill, just fix me, I'm fine, thank you. But it is important that all the way through, procedures or through, I suppose if you're in the hospital or the surgery, that you do understand what is happening. So don't feel anyway, ashamed or, oh, I couldn't be asking that. Please ask, what is that acronym? What are you talking about? Explain it to me in plain English, please. So the third one then is the check for understanding. So this is the one where, is confirming what the doctor has told you, that you understand it. So after the doctor has given you some information, a new thing you have to do, a new drug you're now going to take, you then maybe just to be really clear that you understand it, it's really good to repeat back to the doctor. So, and I have a tip here on how you do that. So you could say, so imagine he's just said something to me and I'm going to say, okay, so doctor, here's what you're telling me I have to do when I go home. The new drug that you're giving me, it's a tablet, it's blue. And I have to take that every evening at 6 o'clock. Is that right? Yes, it is, Helen. Okay. And then maybe then even by repeating that, one of my questions is, and how long am I taking that for? Oh, it's a drug now that I'm going to be on for the foreseeable future. So I'm going to have to take that and will I only ever need one of them? And again, there's another answer to that question. So just teasing out a little bit that you have more information when you leave about what you have to do and understand it. Because what do we all do if we don't get that information? The minute we get home, we open the leaflet if anyone reads those leaflets, start reading everything, worried about what's in that, because invariably the drug that you're taking is probably to fix about 10 things, not just the thing you have it for. Or then we'll go online and we'll start looking up again stuff that is not suitable to our particular case. So ask the experts while you're in the room, find it out. And I would also say to people, do not feel bad about picking up the phone. And I know it's a busy time, and I absolutely, look, all of us know our surgeries are really busy with vaccinations at the minute. But if you didn't get the information clearly when you were at the meeting with your GP or doctor, your consultant or whoever earlier, pick up that phone and ask that question again, or leave a message on the voice machine and get that question answered. Because no doctor at all wants you to be misinformed or not fully understand why or what you have to do and maybe why you have to take that. So I think and the phone is a great thing. I've used it a few times. I remember having to give my daughter a steroid and I had to put it in water and she didn't like it and she sort of threw it and it went all over the carpet. And I was like, oh my God. So I had to ring the chemist to say, I've just lost one of these, on steroids, you have to take them and whatever. Brilliant. No problem, Helen. You do need to take them. It's not something you can just say, oh, leave it. I'll get you another 2 and we'll have it down here for you. You know, so please do, if you forget and you kick yourself after you get out of the appointment, pick up the phone and ring them the same day or the next day. Medicine labels are really interesting around sort of understanding. So this is a typical label that you might see. We lifted it from one of the things. And as you can see, there's a lot of things there there's a lot of information, first of all, but it's written in capital letters, which is not great. If people have a look at the instruction there, 2.5 ml spoons. Well, what does that actually mean? Think about it, 2.5 ml spoons. If anyone's good at maths, 2 is actually 5 mils. So the label would have been much better and easier written like this, which first of all is written not in capital letters, in smaller sentence case. It tells you that it's a penicillin antibiotic in the top line for an infection. Great, you know that if somebody is caring for you or you feel unwell, someone can go straight to where your cabinet is and go, oh, this is what Helen's on. She's on something, a penicillin here for infection. And the instruction is much clearer. Take 1 5 ml spoon and look at that in the morning and 1 in the evening. So in the previous example, it was 2.5 ml spoons twice a day. Whereas this is much more specific. It's the 1 5 ml and 1 in the morning and 1 in the evening. So it's just giving you an example there of, again, you're probably going to get your label like this. We're lobbying hard and with Europe to get your labels like this. So again, just to be clear before you leave, and look at the examples in the right-hand corner there. See the highlighter pen? So again, really important that if you're struggling as well, say that to your pharmacist. I'm not really sure when I meant to take that. And they'll right, well, take it, at this time, and you must eat with it. So have it with your breakfast. And the pharmacist will sit and have a chat with you through and maybe work out how many times throughout the day you need to take that. My biggest bugbear, and I mentioned earlier, give feedback. I must write in and give this feedback, but this is a challenging one. I would get chest infections a bit and have to take Exbutex. So it's a really good and it's a good thing. But the instruction always, I struggle really hard with the instruction. The instruction tells me, here over this side, you can see dosage. It says initially 15 mils 3 times a day. So just even that line, forget the bit underneath. And underneath, I always have to divide 15, 5, 3, and it actually it means take 3 5 ml spoons initially, 3 times a day. And why couldn't they show it to us? So again, some simple ideas to try and feed back to people to say, look, this could be written and be clearer. Okay, so the final piece then around the tips and strategies really is ask me 3. And this is the piece where you don't leave a meeting without knowing the answer to these 3 questions. And the easiest way for me to explain this probably is through an example. So my main problem is that I have a stomach, my stomach isn't too well at the minute. So I have a tummy issue and I'm now taking a tablet. What I need to do, well, I'm now given a new tablet that hopefully will stop the reflux and stop that. Okay, and I leave, oh, thank you, doctor. And I leave then. But what I need to do, I need to take that tablet with food. Oh, okay, thanks. And so, but the third piece is really important. Why do I need to take that tablet with food? Well, actually, you need to take it with food because it's quite a harsh tablet. And if you take it on an empty stomach, it could upset the lining of your stomach even more. And you might get an ulcer. Now, I'm making this up it's not a real, so, but the why piece there is really important because that's more likely now for me to take the medication in the correct way. So on request, you'll see a little credit card there, a shaped small little thing there on the right hand side. We actually got these printed up because people wanted to have this in their wallet when they went into the surgery or the chemist or wherever, that they could actually remember to ask those 3 questions. So again, if anyone wants any of those cards, if they can, my details are at the end here. You'll get me anyway. If you look up Helen Ryan and Nala, you'll get my email address and I'm happy to send some of them out to people. Great, so that's just a repeat. That's the summary slide I just changed. Instead of the doctor, it's the pharmacy. So being prepared, ask your questions, check that you understand, and ask those 3, or don't leave the surgery without knowing those 3. Great, so here I am now at about, what we are, 5 to. Have we any questions from people? And we'll have a look while we're doing that. what is the number 3 for questions to ask? So sorry, did people get that? That it's the why. So the why is really important, that you would always know whatever instruction is being given to you, that the why bit. So again, a really good doctor, Austin O'Carroll, who we have worked with before, and he's a great doctor in the inner city, would be really good in using visuals with his patients. So he was working with a patient, I remember he told this example, who had a really severe, his liver was not in good shape. He said, what's my main problem? You know, really bad liver disease. You need to stop drinking. So that was the big, you know, and the why you need to stop drinking for this particular patient was, if you don't, you're going to die. It was really stark, and I'll never forget that example, because Austin would have told us this at one of our health literacy events. And in fact, he had to go one step further. He used visuals there where he got a picture of a healthy liver and this gentleman's liver. And he said, look, this is why I need you to stop. And it worked. So again, you know, the why, it can be really important for compliance. My information is here, just if people are looking for our details, and we do have lots more information on the website. I know people are probably heading to lunch, but please, happy enough to follow up with anyone as well. They can email me, and hopefully just the sort of 4 concluding points really is that I hope you got from today is that, you know, that we all need good health literacy and numeracy skills throughout our lives. We'll all need them if we're engaging as we engage with health services. That delivering a literacy friendly service matters. So again, we do a lot of work, as I say, with frontline staff, and it is really important, and that feedback really, you know, is important. You're hopefully now more health literacy aware today, and you know, your feedback can really make a difference. And you know, any of the services and the health professionals we've worked with really want to have a service that's effective and efficient. So tell them, and they really will be delighted to hear ways of making things better. And then the final one, as I say, look, really is ask that question. And yeah, that's, as I say, if anyone has any other questions, I'm happy to take them now, or please feel free to just, they can ring me or email me with anything there. So.
Helen, thank you so much for such an insightful presentation. You've covered so many individual kind of topics there, and in a sense raised some really kind of vital issues in terms of just why health literacy is just so important to all of us at all stages of our lives. I found the video with Michael very emotive and quite powerful, really, in terms of that transition, and just as Michael pointed out, just the ability to be able to ask the right questions and to actually get your message across, and also just the role of kind of service providers, and it can be in terms of hospitals or doctor surgeries, in terms of signage, or just in terms of, you mentioned very fantastic project there with Tala Hospital, in terms of taking away you know, the possible embarrassment of somebody with literacy issues not having to fill out a form. That was really instructive to hear about that particular example, and just really got across the message as to why health literacy is just so important for all of us, and just the various, and to be aware of the challenges that people with literacy or numeracy challenges actually face on a daily basis. From, it can range from, you know, maybe missing a hospital appointment or a doctor's appointment, to actually then not actually having the confidence to ask the right questions of health professionals. So thank you so much for an incredible presentation. We just have a couple of questions I think have just kind of popped in, so we'll just have a quick run through of those. First one really is in terms of, would health literacy actually also mean understanding information, in that we can often read, but we don't always understand what we're reading?
Yeah, absolutely. So again, and you know, there are places for people to deep dive a little bit further into this. The older we get as well, on the cognitive level of even trying to absorb and understand information is a challenge for all of us. And even at the minute, look at all the COVID information we have on top of everything. How many vaccines? What does each vaccine give us? Oh, it is information overload. So it isn't just as simple as I can read it. It is absolutely reading and understanding. So in fact, health literacy really and truly affects every single individual. And then the particular group that NALA would work with, and that we would be sort of really trying to empower and get back to maybe brush up on those skills, would be people who would struggle with the reading piece as well as the understanding piece, you know. So it's but you're so right, it all of us, it's about the reading and understanding.
And again, just to follow on from that first question from Ada, just mentioned that sometimes we don't always understand what we're actually being told.
Mm-hmm. Yeah, No, and again, that's why the check for understanding slide I use with health professionals. So I will work with, if I was doing this for nurses and doctors, and there may be some speech and language people here today, I would say to the healthcare people, now you make sure that before anyone leaves your appointment, you ask them to repeat back. So I did some training with the Royal College of Surgeons there recently. Sorry, that's my thing, with the Royal College of Surgeons, and I met a really interesting registrar there, and she was great. Now, English wasn't her first language, so she was really good. She was great. So she said that she says to every family that leaves Temple Street, now, I'm not letting your child go home with you today until you tell me, repeat back to me in your own words, every single thing you have to do with your child now. And she said she felt she got away with it a bit because English wasn't her first language, but she was really clear. So the parents would have to stand there and tell her, yes, doctor, here's exactly what I'm going to do with my son or daughter when I go home. So it's while I'm waiting for every single health professional to do that with people, because I know it takes, now there is research to say it takes 2 minutes. That's all in America, they've looked at that. Imagine what 2 more minutes more to an appointment, could really have such great positive kickback, but not every doctor or person is doing that at the minute. So that's why in the slide in this presentation I have for people is I'm telling you as a patient or as a consumer, as a not a consumer, but as the public, don't leave the appointment until you have repeated back to the doctor, the physiotherapist, whoever, the nurse, and said to them, is this what you want me to do? Am I now to go home? And so think of that gentleman, John, and the wound. John would have needed to say that day. So thanks for putting on the dressing. See you next Wednesday. What happens if something goes wrong between today and Wednesday? And she's, oh, just ring the surgery, we're open. And then John would say, well, hold on, you're not open Saturday and Sunday. So what I do if it's sore Saturday, Sunday? Ring the emergency out of hours and here's the number. So, keep at it till you don't feel, a lot of people tell us that they feel they're a burden by asking these questions. Oh God, I couldn't be asking and wasting time. You're not wasting time. It's your health, your body. You are the expert of your body. You know what's good and what doesn't work. And do not ever feel bad about asking questions. I mean, yes, it can be, and I'm hoping that all the medical professionals have the bit of time to give you if you need it answered. And if not, you can say to them, well, when is a good time for you to answer my questions then? Because I'm not happy that I'm leaving this appointment today knowing everything I need to know. I mean, there is an empowerment. There's confidence to do this. It is. I don't, by any stretch, tell you or think this is easy to do when you're looking at your GP, your consultant. It is hard, but please, it's your health and your healthcare. And I would suggest I always think of Vicky Phelan, and when they said to Vicky that she could go down this road, Vicky said, "What other roads are available?" And they were like, "We don't know." She says, "Well, I'm not happy to just pick that road. I'm going to go off, do a bit of research, and I'll come back to you." No.
One more question, and at the moment it's just the last question we have. How do we conduct high quality research of health literacy? Is there a measurement of a literate population? Is it randomized or is there crossover?
Yes, so there's two pieces on that. The first statistic that I gave people would have been from the OECD, so that's the Organisation for Cooperation and Development Education, the big place, and that's the PIAC, the Programme for International Assessment of Adult Competencies. That's the big survey that is for about 5,600 people were surveyed. It's about an hour. It's offered to you on computer and paper, and so that is really and it's an everyday test. So in all fairness, the test is a mixture of, it could be a little leaflet, could be a health leaflet, could be a shopping list, working out a budget. So it's a mixture of everyday reading and writing and technology skills to get remember the first statistic I gave, the 1 in 6, the 18%, and the 1 in 4 for numeracy, 25%. So it's quite rigid, and it's all well backed up and whatever. It's done by the Central Statistics Office. The health survey then that took place, the EU Health Literacy Survey, was done with less people, but they used health-specific material. So it was very much the health leaflet, the filling, actually the forms, it's not, writing is not. So we have no statistic in Ireland about how people's writing is. It is really the reading and the numeracy and the digital. And that, the good news on the health literacy side is the Department of Health and Sláinte Care have just recently funded a new health literacy survey that took place actually within our COVID good window last year, and the results are in the department at the minute being scrunched and looked at. And as I say, those results will be coming out soon. So it is happening, and UCD did that. So it's being done by all above board, and rigorous statisticians are looking at it. So we look forward. We don't know what will be in the results in May. Hopefully we hope that they're better, but what we will always looking for then is, well, where are the gaps here now? Are there particular groups of people that are struggling more? Where can we go and improve their health literacy skills? And I suppose the health literacy is about the information that you need to understand about your health. So sometimes when people hear literacy, they think, oh, I can't read a novel, and absolutely there are people who will, but health literacy is about, I can't read the medicine leaflet, I can't work out the medication. The other literacy, which Nala work on as well, absolutely, we need to help and brush people up on that as well. But the health stuff is a particular angle on it. And I think we've done a lot of work actually around sort of health and well-being courses for people. And even simple things, people are amazed at what they take away from that. Things like reading labels, food labels, how to portion sizes. So we've lots of conversations with people around the literacy and numeracy and digital side of the health world, which is really interesting. And I suppose happy to chat to anyone else if they wanted to get some of those resources that we have. There's another few slides on this that have some of the resources there as well for people.
Brilliant, Helen. We just don't have any more questions for the moment. Just people are just, and we very much appreciate it, just popping a few thank you messages in the chat. Thank you for the presentation, Helen. It was very informative, really interesting. Thank you so much. I have learned so much. Thank you for the very informative presentation. So to those of you kind of looking in at home, we very much appreciate you taking the time to join us today for the webinar, and for your kind of feedback. It's very much appreciated. Just in terms of our own library service, obviously in Dublin City Libraries, you're very much aware that our doors unfortunately are closed and will be for the foreseeable. We have a wonderful range of online resources and various kind of supports for the public at the moment. So we would recommend kind of going to our home website, dublincitylibraries.ie, and on there you'll get an insight to the range of online services, Ask a Librarian home delivery service that we actually are up and running at the moment. So if I could just give a mention to some of our online resources, in particular, say Borrow Box, where you can actually borrow a range of ebooks and audiobooks. And there is just a flag that there is a dedicated Healthy Ireland at your library collection as part of the Borrow Box. So a wide-ranging range of books available on a whole host of health topics. And also, if books may not be a thing, maybe magazines, you might have a preference for looking up, say, books on health or fitness or exercise. The online resource there to give a mention to is Orbi Digital. And again, they're all kind of free, easy to use, to download, and all the instruction guides are actually there, on our website. So just to mention that, and just again to have a look at our website, dublincitylibraries.ie, just to get a sense of all the range of services that we are still able to provide 24/7, even though our doors may be physically locked at the moment. So a final thank you once again to Helen for such an incredible presentation. It was so insightful, so informative, and addressed so many issues around the very important topic of health literacy. Helen, it's, as I mentioned at the beginning, an absolute pleasure for us in Dublin City Libraries to partner with Nala to deliver this webinar as part of our Healthy Ireland programme. And just a final thank you for such a wonderful presentation. To all of you at home, thank you again for kind of joining us today. Just keep an eye on our website for other information sessions, talks and webinars that we have as part of our upcoming Healthy Ireland at Your Library programme. And I'm now going to end the session and to say a very good afternoon to you, and thanks again for joining us. Just to say goodbye.